to participate. Hopefully everyone is okay with me recording. So here's the thing, right? I have to find a way to condense the content so that it's not too much or too little, and finding a way to put it in an order that makes sense. And it's not always possible, because if we are going to talk about carbamazepine or bipolar, if we're going to talk about bipolar, we may have to talk about mood stabilizer. So, and then we have to talk about the treatments, and then we have to talk about what's safe. So the content sometimes is talked about of the a medication here, and then you might see it under another portion of the course where we talked about neurotransmitters or something that's related to it. A good example of that would be olanzapine and I don't know, like another medication that has increased metabolic condition, right? Or for example, clozaril and carbamazepine, right? So I talked about carbamazepine separate, but then I bring it together in a session in which both cause agranulocytosis. So that's usually is the best way to condense the content, so that way you are getting the most content in a condensed way that's not feeling overwhelming, right? Can you imagine starting for this test and not feeling overwhelming? It's impossible, right? Because it's a lot of content. But the goal here that I also want to kind of bring your attention to is that we are not in nursing schools anymore, right? We're not, especially the BSN, especially master's or doctor's degree, in which we all want 100%. The goal here is to really feel like good about testing. The goal is to feel like, man, this testing cannot get me. I can miss 1 or 2 or 3 or 5 or even 10 or 15 questions, but I will pass with a high standards, right? Without being stressed. So if we cover everything, we could easily be on this course for 6 months, and that's not beneficial to you, and it wouldn't help you, right? So the goal really is to kind of like get the material, understand it, digest it, dream about it, talk to yourself. In fact, we are launching a new addition to the course, which you'll be able to teach each other, be able to set up rooms where we have live content, and we'll assign topics of the course so you can teach, because that's the best way of learning is teaching. When you can teach the material, you know it, okay? And it will only be for the people that are in the course, and then this will be helpful to you, and it's not mandated. It's an addition to. Every time I add anything to the course, never ask for money. Don't ever get a call from anyone asking for money or a code. These are scammers, right? If you ever have doubt, ask me to be like, hey, come alive with me so I can see your face. And even that, it's dangerous because AI nowadays are cloning everything, right? So just be careful with that, okay? So yeah, to answer your question, I think it's difficult to talk about a medication and talk all things about the medication without interfering with the other aspects. In regards to the neurotransmitter, not all of them are important, just very few, very, very few. Those that we talked about are the most important and are the ones that you're likely to see on your test, okay? Because there's too many receptors, neurotransmitters, and so forth, right?
Thank you.
Absolutely. What other questions can I help you guys with?
Hello, Dr. Lopez. This is Gina.
Hello, Gina.
Hi. Do we have to pay extra for the question bank when we sign up for? Okay, keep saying that I need to pay $79 or so.
No, you don't have to pay a thing. At the end of the program, I will log in as a student. I created a student account, and I created my account, right? So I'll show you what may be causing the problem, but you don't have to pay anything. It's all included in the program. There is nothing to pay ever again, unless if you want to do the advanced psychopharmacology, which is I do not advise for anyone taking the board. Why? It's too in depth, but you do not have to pay for nothing, Nothing. Okay.
All right.
Even if you want to meet with me, you're having some issues and you want to like talk about life problems and whatever. If I have the time, it's always free. Okay.
Thank you so much.
Absolutely.
Dr. Lopez,
Yes,
and I'm
please.
talking about this question bank. I already went through all the questions in the program, but I saw you in the short that you were mentioning something about 450 questions. Those are the same questions that are already, or there are extra questions on it?
No. So I put an addition 550 question as of 3 days ago, which by the way, I have to go through it and make sure everything is correct. I have someone that works with me and he uploads all the questions and things for me. And sometimes
But it's still not in there, right? Because
it is
still
there,
not in.
but it's not in the page that you are seeing. Okay.
Oh,
So I
can
have
you guys just
a
at the end,
page.
because
I have a page for question bank only. I have a page that I introduce the question bank and the course. So at the end of today's program, stick around and I'll make sure that you have the question bank page only. Okay.
thank you,
So
doctor.
yes. So it's two question banks, one with 850 questions and another one with 550 or so forth. And I'll be adding more questions on the fly, especially for those with testing for the ANPP, the new psychiatric board certification, right? Because I know A and C kind of will be very in depth, but we want to go broad stroke for the other one because it's more of a, or either you know if you don't, right? So
I'll
stick
stay
around
then.
at the end. At the end of the course, I'll take a look on your account. If you don't have the question bank page alone, I'll make sure you add it, and by today's event, end of today's event, you will have it.
Thank you,
Okay.
doctor.
Absolutely my pleasure. Guys, never feel bad about calling me out. Never feel bad about not understanding the content. Never feel bad about anything at all, right? Everything is valid. So I'm here to serve you and to work with you. If you ever have a question, now, if you ever have a question, the best way is to send it to my email because I always see my emails, right? Our WhatsApp group is a fantastic way for you to communicate, discuss, but it's a lot of messages. So sometimes I might miss your message there. So if you have a question, email me. Okay, email me mpclubconnect, mpclubconnect@gmail.com. I'll go ahead and put in a chat box so you can see it and you copy it down. Any question, you can always email me, okay? Of course, I'm always monitoring every day, many hours per day, our WhatsApp group, but I want to keep that more of a related to the program. Hey, I don't understand this. Can you help me out? Oh, I have a question about this. Can you help me out? Oftentimes, the best thing is the other students who took the test, they will help you even before I get to the answer. And I'll just collaborate or give it an extra 2 cents into it. Okay. All right. Any other questions before we get started today? And it's fine. You can always ask the question at the end or you can ask now. All right. I don't want to take too long to be respectful of your time. We are about to get started. And if you have not used Kahoot yet, I'll show you how to. Okay. So 1 second. All right. So I trust that by now you are seeing my screen. So if you have not played Kahoot, the best way of doing so is by using your phone. On your phone, you type it in www.kahoot, KAHOOT.IT, not .com. And then it will ask you for a nickname. You can say your nickname. You can make one up. You can call your name, whatever it's important to you or whatever you feel comfortable with. Then you log in on the PIN code that's exclusive for today's event, which is 681-2926. All right. So I like to find motivation every time, whether it's for myself or for others. Motivation is the key for everything, right? So at the end of today's event, if you are the winner, I will give you a $200, $299 code, coupon, or whatever you want to use towards your next class with the NP exam coach. Okay, so most of the people use that for psychopharmacology course. All you have to do is win today's event and email me and text me and WhatsApp me, whatever, after the event, so I know who you are. Unless if you put in your own name. All right, does it sound fair? Okay, so just don't win it today's event and claim your bonus. Okay, so is anyone at this time not able to log in and need some assistance? If you do, it's totally okay. Kahoot can be complicated in the beginning, but it gets better. It's more easy to digest as the time goes. So right now we have about 10, 13 people, and I see 16 people. Maybe me, I'm double logged. So it might be one or two people that have not been able to log in. Hello, hi, Mrs. Brown.
Yes.
Hi.
When you log out, when it kick you out, how do you get back on? Because twice it kicked me out.
Oh man. So are you using your phone or your browser?
I'm using my phone and I'm also using my laptop.
Okay, your laptop, you're looking at the question on your phone, your answer. See if you can log in into a different browser on your phone. Like I have Safari and I also have Chrome.
Okay.
Because sometimes it does happen. I see it log in or log out, but I do not necessarily know how to answer that question. Okay.
Okay.
But
I'll try this week again.
Yeah, try. I'll wait for you. Okay.
Okay.
No worries. Yeah, guys. So another option is to just listen, but I encourage everyone to never just listen. Participate. And that goes to our course, right? Especially in our course, because it's a small video format. It's easy to digest. But no one ever learns by listening alone. No one. You have to do something. Writing down, activate your right parietal, the right side of your brain, right? So the more you write it down in the PDF, along with highlighting the important information, the more beneficial it will be for you. But if you want to go a step further, use the Brainscape app and make it your own flashcard. Of course, I have my flashcards there for you. But again, the more you do it, the better it gets into your brain and you will never forget, especially if you use Brainscape. It's a wonderful way of studying. That's what they call the ultimate effective way of studying is by using Brainscape. Alternative to that would be Anki. Just that Anki is a little bit more cumbersome, right? A little bit more difficult. All right, enough with that. Is anyone right now not able to log in? Otherwise, we are about to start. If you're not, please unmute yourself, say something in the chat. I am happy to wait a few minutes and we can get started. Okay. All right, I guess we are about to get started. It seems that everyone is ready to go. So last minute here, advice. You answer with your phone and you look at the question on your screen. That's how I would do it. Now, when you answering the question, you get points for being correct, number one, and you get more points or a little bit more points for being fast. This is helpful to you. In the past, we had other students that took the course with other course creators out there, and they were only able to do 150 questions, right? That's not helpful. guess what? Unfortunately, the student didn't pass. So it's helpful that you do the PMHNP diagnostic test, not only because the information that's helpful to you, but also timing, right? It's very different answering one question versus answering 175 questions at once. So make sure you're practicing your time. Okay, we have 14 people ready to go. Good luck, everyone. Make sure you claim your psychopharmacology course after you finish with our 30 days PMHNP walk to success. Let's get started now. Oh, I see some fast answers there. All right, we have 30 seconds left. $19 seconds. All right. Okay. So here we have serotonin and norepinephrine. Let's take a look here. Why? Okay. And I think I have to change this question on the question bank. I know there was an issue with this question specifically, but serotonin and norepinephrine is the correct choice, right? Both serotonin and norepinephrine is implicated in mood regulations and are chemically associated with the anytime you hear dopamine and GABA, if you hear dopamine, GABA, write this down, guys. Dopamine, GABA is for SAD disorder. If you hear dopamine and GABA, that's for disorder. Serotonin, norepinephrine, implicated with both, implicated with, especially with mood regulations. Okay. I know there was a repeat question from our question bank. I'll make double check that all the answers are appropriate on the question bank as well. All right, next question. If you have a question, please unmute yourself, okay? All right, we have 30 seconds. Okay, so let's talk about this question here specifically, right? Cradle took the lead here today. So after you read the question, the next thing you do is ask yourself, what is the question asking? For this specific question, it wasn't too complicated. It was fairly easy, right? But here we had the important piece of information, lithium level at 1.6. Okay. Lithium level at 1.6. That's above the normal. You know, anything above 1.5, that's kind of like getting to toxicity. Lithium is a wonderful medication, but does not work fast. When you have a question that asks about suicidal behavior, don't pick lithium right away because lithium takes a long time, right? And it's especially it's good for bipolar, but don't take lithium right away. So when the lithium level is 1.6, it's in toxicity. Now I want to talk about something else. When the lithium level is 1.3, do when the lithium level is 1.4, what do you do? It depends. Lithium level at 1.3, symptomatic or asymptomatic. Symptomatic, you stop the lithium immediately, and then you order the labs. 1.4, is it symptomatic or asymptomatic? Symptomatic, you stop the lithium, then collect labs. Now, if it's 1.3 or 1.4 and the patient does not have a symptom, asymptomatic, then you continue to monitor. Maybe order labs, which means continue to monitor, okay? 1.5, automatically stop. 1.6, it's definitely a stop. Lithium has a low therapeutic index. Hard question, isn't it? All right. Very hard question, okay? Let's take a look here on the explanation. Okay. Serotonin and dopamine for mood disorders, right? We said serotonin and dopamine for mood disorders, including bipolar, often involves a deregulation of both serotonin and dopamine system, right? Mostly, right? Low serotonin levels are associated with depressive symptoms, while elevated dopamine levels are linked with manic or hypomanic symptoms, right? And this is comes back to another fact that you should be aware of. Never give any anti I wouldn't say never, but it's advisable not to prescribe a antidepressant for patients with history of bipolar, even family history, which is the number one factor for you to distinguish is this bipolar or not. Ask them, hey, do you have a family history, right? And if they answer yes, really dig in. Is this bipolar or borderline personality? Because the patients tend to confuse. But when you hear moods, think of specifically about serotonin and dopamine. But we know it's more complex than that. Okay. Now, dopamine and GABA here, right, is primarily an inhibition neurotransmitter, and their GABA specifically is the inhibition neurotransmitter, and primary role is not in mood regulation, but rather in rewards. And here we are talking more about patients with not mood disorder, with alcohol or other drugs, which dopamine is a lot of a motivation, and GABA, right? Seeking. When you think of dopamine and GABA, think of dope for coke and GABA for, I don't know, like anxiolytics of some kind. Okay. Dope and GABA is for SOD disorders. Guys, if you do have a question, please raise your hand or speak up. I cannot hear you well here. Oops. Okay. All right, good job, guys. If you hear a question, if you see a question and it says coarse hand tremors, that's toxicity for lithium. If you hear a question, it says fine hand tremors, that's a side effect of lithium. So you continue to monitor, right? But if you see coarse, you stop the medication and then collect labs. Did anyone ask a question? I cannot see your screen. Go ahead.
Can you repeat that when you what you said about the coarse tremors and fine tremors?
Yes. So side effects versus toxicity, right? We have to distinguish both in lithium. One, what is the side effect of lithium? GI and so forth, right? If a question ever says, that's inclusive for all medication. Anytime a question says severe of any kind, that's no longer a side effect. That's a toxicity level or beyond what would be expected, right? Severe nausea, that's not a side effect. That is a toxicity level, generally speaking, right? So for lithium, if you see tremors, it is not a fine. Because fine tremors you cannot see. Fine tremors is a side effect. Coarse, you can see, that is toxicity level. Does it answer your question?
Yes. Yes, sir. Thank you.
Okay, absolutely. Please stop me or just unmute yourself and ask the question because I cannot see your hand raised. Okay, let's go on to the next question. All right, Jeanette. Let me plug in. Oops. Actually, let's go on to the rationale. Okay, next question. I'm gonna All right, so we have a question here with alcohol and lithium. First thing should come to mind every time you hear lithium, dehydration, or being careful with it being outside. It's too hot, right? So let's see what this has to do with anything, right? Yeah. So this may be higher due to the decrease in renal function, right? So explanation, alcohol can affect kidney function, potentially reduce clearance of lithium from the body. This can lead to a higher lithium level, increased risk of toxicity. It's important to monitor liver level closely in the patients with a history of alcohol use disorder, okay? So someone raised your hand there, please. Go ahead.
Yes, Dr. Smith. So talking about this question, on lithium and alcohol. So how we can differentiate, how we can, because alcohol can be inhibitor or inducer. So, and the question I was trying to identify if the patient was some kind of chronic alcoholic or something to see if it's inhibitor or inducer to answer the question a better way to, because I have both answer, or you decrease lithium or increase lithium. So we're talking about inhibitors or inducer.
Yes. So two things here, right? So if it's chronic, right? If it's chronic, then will be more of an inhibitor, right? So if it's acute, it'll be more of an inducer. Okay, if it's acute level of alcohol drinking, is an inducer. If it's chronic, is an inhibitor. It kind of makes sense, right?
Yeah,
So
it does.
another thing is that alcohol causes dehydration, right? So that because of that, lithium levels will increase. Okay. Now lithium is also excreted by the kidneys, right? So we have to be careful with that as well. So when someone is a chronic alcoholic, you also have the impact on the liver, right? So, and that can be double sword of of a question. So, did I answer your question? Did I answer your question?
Thank you. Yes.
Absolutely. All right, next question. All right, hard question, right? Yep, as I figure we would be all over the place, right? So the first thing to ask you, what is the question asking you? All right. And then after that, formulate an answer. Why would think that someone in the depressive stage could use lithium, right? What is people with number one, not number one, but what's one of the factors for suicidality, right? Is impulse control. When you put someone on lithium, that is reduced. Okay. But very hard question because I can see going in different ways, right? Now, if the patient is an outpatient, maybe lithium will be appropriate as long as they're not immediate risk. But when you have a patient that's inpatient, you do not want to start lithium because lithium takes a longer time. If you have a bipolar patient or someone with suicidality, right? You do not want to start lithium. You rather go for a antidepressant if that's appropriate, or Depakote because Depakote is faster than lithium. Otherwise, you might have to keep the patient for the next 3 weeks inpatient. Not a good choice, or not the best choice, I would say. All right, guys, good job, good job. I can see prescribing diuretic for food balance. It's not the best answer. If it said imbalance, then it would make this question extremely hard. So make sure what you are answering is not just modified by few letters or something like that, right? Because you're not direct for food balance. You want to control the imbalance here. Okay. All right, Brandy. Remember when they said severe, right? Anytime it's severe or something along those lines, excessive. So we're looking at the toxicity. And that's taking strategy that you can use if you do not know what the question is asking you about. If you see severe or excessive, it really is trying to say, hey, this is toxicity level, okay? And then when you do that, your first action is always to stop the medication. The question will often comes with labs as an alternative. You first stop the medication, then you confirm with the labs. All right, you guys are fast. Look at that, 14 answers. Maybe someone is missing 15 now. You guys are on it. All right, good job, guys. So you guys are catching on to the team. If you really pay attention on the question banks, it's like the task will be so easy because it kind of almost guides you to it. The question banks will help you. Piece diagnostic test, right? As I mentioned, 10 termers, that's course. Courses excessive or severe side effect of a medication here refers to lithium. So you stop the medication and then you confirm with the labs. Oh no, did I lose you guys? Hello there. Oh man, hopefully my connection is not bad.
We can hear you, but we can't see the question.
Okay, 1 second, please. We have 4 answers. Can you see the question?
You can see it on your phone, but it's not on the screen.
Oh.
Okay. So look at your phone, guys, because I cannot see the question. So I think I lost internet connection. That's might be the reason why. Oh no. All right, you guys choose more. I don't know what the question is, but let's see if it will help if I switch here.
I didn't have time to see the question.
Yeah, I don't even know what the question was. I think my internet here is too slow. So educate the patient on the lifestyle medication. So that's important. I don't even know the question. Okay, but think this way. If you ever have a patient, especially on antipsychotics, write this down because it's important. If you have a patient on antipsychotics and they're stable, yet you're getting fatter, or the metabolic syndrome is getting to them, you do not want to destabilize the patient. The first thing you ever do is involve the patient on lifestyle modification. Okay, I'm not sure if the question is related to this, but if you have someone stable, please do not try to prescribe another medication just because of a side effect, right? Try to do lifestyle modification. Again, this is for the test. Real life, may or may not be the right choice, because we know the test, everything is perfect. You have all the resources, the time, the money, everything you need to be happy, and the patients have the best outcome. Real life, if they could do lifestyle modification, they would already have done most of the time, right? Do I have any questions before we go on to the next question here?
I think the question has to do with suppressor and metabolic syndrome.
Okay, so I was close just by seeing the answer of lifestyle medication. So that's close enough. I didn't see the question, but yes, thank you. Again, guys, ask yourself, what is the question asking me? For every single question, create that habit so that you're not tricked by nuances. Here we have somebody stable. Something happened, right? All right, good job, guys. So I want to do a little bit of process of elimination here. Hypothyroidism. Hypothyroidism. Why would you not pick this answer, right? You would not pick this answer because hypothyroidism, everything is slow, right? The patients usually are cold intolerance. They usually are slower to go to the bathroom. They have a low heart rate. They have constipation, right? Now, hyper, everything is fast. Heat intolerance, they are eating a whole lot. They are moving a whole lot, yet you're losing a lot of weight. Okay, so by process of elimination, you could easily take the green choice out. Now here, lithium-induced nephrotoxicity. Is the symptoms related to kidney, or is the symptom related to GI? Okay, so this is how you could eliminate that. And that question has nothing to do with serotonin syndrome. The name sounds cool, but that's not it. All right, Brandy, you are taking the lead here and keeping the lead. So next question. It is hot. All right, hopefully you are able to pick up from the previous question, right? Oh, okay. All right. So I can see why the blue option is appealing to some. Let's take a look here on the rationale. Okay. So it's a bit expected that it's more expected that the patient will get weight gain than any other symptoms on lithium, right? And it comes with the option of a excessive thirsty. So that's more related on the side effect of the lithium rather than hypothyroidism. Okay. Although hypothyroidism is a side effect of lithium, it does not typically present with increased thirsty alone. So the thirsty, it was what differentiated between the options here that were more intriguing. Okay. So when in doubt, go back to the question, highlight the keywords, and pick your best answer. Okay. But indeed, it was a difficult question, wasn't it? Oh, wow. Okay, I'm not sure why. I think the time it kicked me out. Let's take a look on the rationale and then we'll go for a question related to this, okay? So signs of lithium toxicity, right? Adjusting the dose is appropriate in response to persistent hand tremors, right? So what is the question? There, someone raise your hand. Can you please unmute yourself?
Oh, hello, Dr. Lopez. It's good to talk to you. This is Frederick.
Hello there.
How you doing? I had raised my hand because I thought the time went pretty fast that time.
Yeah, it was. Unfortunately, they don't have a mode in which you have to set each time for each question separately. So this is, like I said, it's on me because I should have checked the time, but that one was set for 20 seconds. So I do apologize for the fast question there. All questions should be set to 1 minute, but too much data entry, sometimes it gets to the goal here. Sorry about that. Okay,
Doctor,
yeah.
I don't know. I don't know if I'm right, but I would like to say something about this. First of all, yes, the time was fast. I didn't have time to, but in the answer here is to assess for other lithium toxicity signs. In my opinion, so I don't know about the because what the patient what the question was telling me was symptoms of the lithium, not toxicity. So we can teach the patient about what is the toxicity. So why we have to wait until to see if there is any lithium toxicity in the question as a right answer. I don't know if you got my point.
No, I did not. Can you rephrase the question, that please?
I'm not looking at the question right now. I forget about it. But and the question talks about lithium signs, not toxicity. Not toxicity. So the correct answer is assess for other signs of lithium toxicity. So why the last one, educate the patient about a potential sign of this of toxicity? Why can that be that answer?
It could. Definitely could, right? It definitely could. But which one would be the best answer? So we're going back to, the BSN level. I actually did not read the question, but I did not.
There is persistent hand tremors.
Okay, that's what I was going for. Okay, so when we see persistent, we know now that this was more related to a excessive or
Toxicity.
here should be more toxicity towards toxicity, right? So I would have to see the question again. But is there anything? But I think it was the persistent here in the question might be related to, is this a continuing process or is it it happened now and now it's being persistent? Is this chronic or acute? Right? So because one can say, hey, I have had persistent hand tremors for 1 year or 6 months or so forth, right? And it's the persistent, I am more keyed, generally speaking, when it says severe or excessive, to link it to toxicity. Okay, persistent is pretty close, but the question may have led to be like, I don't know if this is an ongoing, because if it's ongoing for the over a year or a long time, may not be toxicity. Maybe it's a side effect that's been with the patient. Now, if the question had, hey, for the past week, he has had persistent hand tremors, now we're looking more of acute, meaning that the patient's potentially come, if the other side effects are included, it could potentially means toxicity level. Does it help a little?
That is, I understand. It helps a lot, but the question doesn't say the time about. So that's why when I saw the
Yeah,
question, for me it was like, it's a signs of the lithium, not a
right.
toxicity. It doesn't say anything about. So that's what I said. Well, why do I have to wait until to get really, really
Really bad
toxic?
to see it. Yes. Yes, I do not know because I actually didn't read the question. This one was fast, right? So, all right, we'll go back to this question at the end and then we can have a bit clear answer now. Okay. So this is question number, let me see, 24, 23. Ask yourself what the question is asking you guys. All right. So, okay, let's take a look on the green answer, right? Dehydration may lead to lithium toxicity by reducing absorption in the GI, right? So, although that's nearly true statement, but the best answer is dehydration causes lithium level to raise due to the decrease in renal excretion, right? So remember with Kahoot, I cannot put a full answer. I have to kind of make an answer that will fit the description of the Kahoot. Let's take a look here on the explanation. Okay. Do I have a question on this? Did somebody raise their hand? I cannot see your screen. So if you do, please go ahead and speak. Not, we're moving on. Okay. First thing, ask yourself, what is the question asking you? All right. So, so does NSAID, what's the relationship between NSAID, ARBs, ACE inhibitors, and lithium, or any other medication that is utilized by the kidney, right? Usually, anytime you see an NSAID, it will double the amount of lithium, especially if there's a chronic use of NSAIDs, right? Or ARBs, or ACE inhibitors, or any blood pressure medication, in fact. It could affect the lithium level by increasing the lithium level there because of the inhibition on the NSAID by inhibition of the progranulin synthesis, right? It can decrease the renal blood flow. And that's the mechanism for the ACEs and ARBs or blood pressure medication there. You see how NSAIDs are likely to increase, not decrease lithium levels by reducing the renal clearance or excretion? I think that question was misread or the answer, right? Because I hope you know. Guys, look at your phone. Here we go. Now we are able to see it. All right, hyponatremia, sodium, right? What happens? What's the relationship between sodium and lithium? Wow. Wow. Well done, guys. Super proud of you. I thought this would be a hard question. Very, very proud of you guys. Nicely done. If you raise your hand, please go ahead and unmute yourself.
Oh, this is Frederick Dowd. How you doing, Dr. Orphan? I'm glad that you showed the rationale. I didn't know how low sodium would impact the lithium levels. So I'm reading it now.
There you go. You read the rationale. That's the important one, okay? And low sodium is also a side effect of lithium, right? Hyponatremia. So we talked about sodium, now we talked about potassium, low potassium, okay? So we have low potassium and now you have a problems, muscle weakness and palpitation. So if low sodium increases lithium, how does low potassium affect lithium? All right, guys. Wow, you guys are rocking this. So let's take a look at the explanation here. So just recap, low sodium causes lithium to rise, low potassium causes lithium to decrease. Okay, keep it simple. Very simple. So that way we can get this information and apply on our test. So what is the question asking you? Well done, guys. Well done. So let's take a look here. Regular blood tests are necessary to monitor lithium level. Okay, it is a true statement. Another test taking strategy is asking yourself, what is the questions asking me? And then see if the answer matches the question, right? Because here we have a true statement. Regular blood tests are necessary to monitor the lithium level, but does it answer the question? Okay, how is that? How is that better or worse than I can't stop taking? I can stop taking lithium if I feel better and my mood stabilizes. So the question asks you for further education, right? So you have a true statement here, the green option, but it does not answer the question. Be careful with that because that's a very, very known, we call it the hook on making test questions because we put a true statement, but it did not answer the question. Okay. So what is the question asking you? First question, always ask yourself that. Now apply your old knowledge. What did we do when we collect the labs for lithium, right? Can we do this anytime? Or do we look for the troughs, the highs and the lows, right? Randy, you're not playing. You're taking this home. We prefer the same time, preferably in the morning, right? For consistency. You're taking your lab 1 hour after taking lithium, then the labs might be misleading. What is the question asking you? Let's say you have a diet, you're taking lithium, and you said, hey, I'm going to stop taking sodium. What would that do to lithium level? Okay, well done, guys. Very nice of you. All of you guys got it right, so good job. You want to keep it consistent also for your blood draw, right? All right, now we're looking for a correct statement. Correct statement regarding lithium and the water or liquids. Okay, well done, guys. I thought this one would trick somebody, but it sure didn't. You guys are on the roll. You definitely do not want to limit the water intake while taking lithium. Hydration is super, super important. Okay, guys, so this question here, ask yourself, what is the question asking me? Does the answer match? Do process of elimination. Okay. What was the goal of the question here? Okay. So here we had what we call the hook. We put a true statement, but you didn't answer the question. The question asked about the taste of lithium, right? Taking lithium with a full glass of water to ensure proper absorption. It's a true statement. Did they answer the question? Anybody agree or disagree here? It's very important question because you guys knew the content, but yet you fell for the same old trick.
Why would you drink medication with caffeine or caffeinated drink? Especially lithium.
Okay, so
Obviously, everybody, I
taking
guess,
glass.
missed that question.
Say it again.
I said, I guess a lot of, I don't know how many people that missed the question.
I think it was the caffeine that threw me off.
Exactly. Yes.
Yes,
Dr.
absolutely.
Lopes, I think the question needs to be revised. I think the way the question present is asking for the one that we all failed, the one that about 15 people answered. When we're done, you need to look at the question. It is wrongly phrased.
Say it again.
It is wrongly phrased. It's not phrased appropriately.
Yes. So I can't go back to this one, but it's very important that we go back to this one. Let's do this at the end of the course, and then we'll go back to this one, okay?
But the correct answer which was selected is marked wrong.
Yes.
Right.
Also,
Correct.
Dr. Lopez, based on the rationale, is that caffeinated drink should be avoided.
Correct. Yes. So the question wasn't well written, right? But you got the concept of getting the right terminology or the right answer there.
No, the right answer is saying take a full glass of water. But on the thing, it was marked as wrong.
Marked as wrong, correct. So it was a miskid. Keyed in incorrectly.
Yeah.
No,
Yes.
I mean it was keyed in.
I think when you had programmed this in Kahoot, you chose the wrong answer to be the correct answer.
Okay.
Yes.
I'll go back to this one and I'll revise this one. Sometimes it does happen that way as well. So it's question number 42, yes? Oh, 41 actually. Okay, well done, guys. So lithium, right? It has shown to you increased cognitive protection, right? He has neuroprotective effects and can potentially improve cognitive functions while reducing cognitive decline in individuals with bipolar disorder, right? So you hear severe in the question, right? A trick question, huh? Okay, most of you guys got it, but I can see how the red option with the it's appealing as well, right? So discontinuing both of them would be the best answer choice. Severe headache. Hard question too, right? Because you have two good answers here. Okay. Now let's take a look why discontinuing the medication is a better answer than administer antihypertensive medication to lower the blood pressure, right? If I do that and I don't discontinue the MAOIs, the problem would still persist. So taking care of the problem first before adding another medication would be the best answer choice. In reality, we probably would do both. But anytime you hear you see a problem, try to discontinue what's causing the problem to begin with, right? Understand how MAOIs interact with other food is also for us to provide education. Okay, next question. Typical question of what would be the best answer, wasn't it? Okay. All right, so we have a bipolar patient here. Wants to get pregnant, right? What should we do? And how? Okay, I can see how the red option is appealing, right? But here's more of a risk benefit, right? If she wants to get pregnant, if that's what she's going to do, we have to look at the risk benefit. So gradually taper off the lithium and explore alternative mood stabilizer. It kind of offers you both, perhaps both options, perhaps her being pregnant or attempting to be pregnant and also stabilizing the mood disorder. Using lamotrigine could be helpful. Especially for the depressive symptoms. Oh, it's a repeat question almost, right? Close enough. There is key components to the theme of the question that you should pay attention to. To stabilize on lamictal. Right, so that's basically telling you, hey, don't mess with my medication. All right, great. So here is a test taking strategy. If I said that severe or excessive, severe or excessive, possibly a lower titer of persistent means toxicity for any medication. Anytime you hear something that's the patient being stabilized, is stable on the medication, ask yourself what has changed, right? Did the PMH or the CPM really added something else to the regimen or not, right? So here we talked about the patient is stable, right? And we talked about the patient on lamictal on the previous questions that generally well tolerated. Okay. Safe compared to other mood stabilizer, right? So process of elimination would work well for this question. So we know two, black box warning, that the valproic acid could cause, right? What are we concerned about? Guys, if you do process of elimination, this question would work wonderful, right? Okay, so how is valproic acid associated with extrapyramidal symptoms? How is valproic acid associated with lithium? Okay, so, and or either NMS isn't, right? So there was only one choice left. Even if you didn't know the question, use your process of elimination here. Process of elimination here would work very, very well. All right. So let's go to the rationale. Widespread rash. That's severe, isn't it? Fever, malaise, painful, tiredness, right? Indicative of Steven-Johnson syndrome. The potential life-threatening. Do you see how the previous question said something about widespread rash? Here is talking about having a rash that developed after starting Olympic but has since resolved, right? How is that different from the previous question? Remember, I cannot put a full complete answer because of a Kahoot doesn't allow me the full character, so I had to adapt here. All right, guys. So the point here I was trying to make it was to tell the patient to continue Lamictal, because if the rash has resolved, then it's not Steven-Johnson syndrome. Okay. upper right quadrant, Depakote, yellowing of the skin, whites of the eyes, reddish brown urine, and fatigue. What does it look like? All right, process of elimination if you don't know the answer. But it sounds pretty serious, doesn't it? All right, guys, well done. Hopefully nobody picked the red. Tell the patient this is a mild symptom of GI, right? So with Depakote, you are to be concerned with three things: hepatotoxicity, pancreatitis, and the increase of ammonia level. These are the three things that come to mind, okay? So if you see symptoms of, and you need to distinguish between hepatotoxicity and pancreatitis. Knowing the symptoms, distinguish. It's in our course. Severe abdominal pain, vomiting, nausea. Hopefully by now, even if you don't know the answer, you would catch on how questions usually are made. "18 seconds. Okay, well done, guys. Okay. You associate to a toxicity or higher than what one would prescribe or anticipate. In that case, you do an action before you collect labs, right? So collecting labs would be important, but if you hear severe, you discontinue the causing agent before you do anything else. All right, next question. Epigastric pain, fever, and elevated hemolysis level, hemolysis level, sorry. What's the next action? What are you gonna do? What this condition looks like to you? All right. So let's take a look on the yellow question here, the answer, right? Prescribe antibiotics to manage the fever. When someone has a fever, do we prescribe antibiotics? right? I know the intent. You're like, well, if you take care of the condition, you take care of the fever, but that's not what the question said, and the answer said, right? So be careful with adding words to the answer or the question. That looks like pancreatitis to me, doesn't it? All right, we have 20 seconds. Pick your best answer. All right, guys, you guys are catching on to this, right? So, oh, okay. Talk about this for a second. Chlorozolil and carbamazepine, right? ANC less than 1,000. You discontinue the medication. Patient's doing wonderful. Everything's going well, yet has a sore throat or fever. You don't continue the medication. You discontinue the medication, okay? Because that could be a signs of infection. And the least you want is having someone with infection and a granulocytosis at the same time. Okay? So the first action should discontinue the medication, even if the patient is doing wonderful, even if the patient is having a good ANC level. You hear or see signs of infection, you stop the medication, then collect labs. Okay, guys, well done. All right. So again, back to the same point. Although this wasn't a severe, right? But we have side effects. That's very concerning. So stop the causing agent first. Here, when it says petechiae, bleeding from the gums, things along those lines, we're concerned about a plastic anemia. Okay. All right. You see, like the questions coming in the same pattern. All you got to do is switch here and there, a little something to it, right? Wow, you guys are fast. 12 answers. $30. All right. We talked about lamictal and carbamazepine, right? We said something about Steven Johnson syndrome. You pick carbamazepine. It is Asian population. So here the question is not necessarily about Steven Johnson syndrome, but we're talking about carbamazepine, right? So agranulocytosis, aplastic anemia, and Asia population, the 3 A's for carbamazepine. That's what you need to be concerned of. 3 A's: Asian population, aplastic anemia, agranulocytosis. For the Asian population, right? Write it down, HLA, which I like to call HLab 1502. That's how I remember, HLab 1502. Carbamazepine with the Asian population. Need to know the information. Okay, which labs is related to kidney? Okay, so the question specifically asked about kidney, right? Which of the following would be the best labs to collect for kidney, right? In relation to lithium, BUN, and creatinine. ALT, AST is related to the liver, not kidney. Understand your thyroid levels. It's important as well. Okay, last question of the day. So lithium and its treatments, right? Okay. So okay, so understanding your normal labs is important, right? But what we see here, the TSH, is also related to lithium, but that's an abnormal value, right? Because the regular value is 0.525, right? We know that lithium can affect the thyroid function. Plus the BUN to creatinine, you would expect 15 to 1 to be normal. All right, let's see who took it home. Janet, you almost had it. Your third place. Congrats. Fredo. And today's winner is Randy. Well done. Well done. Well done, guys. So, Brandy, make sure you email me. So you won $200 and $299 towards the end of our course after the completion of your certificate, your PHMNP board certification. Email me and let me know which course would you like to receive. Okay. So right now, guys, we'll take a short break. It is, let's do a 50 minutes break. We'll be back at 50 minutes from now. So I think it's, what time is it? What, the East Coast now? Okay. I can barely hear. I got to go back to my room. So I'll see you guys in 15 minutes, okay? So 15 minutes from now, in an hour. So 17 minutes, really. See you guys soon. Bye-bye.